Hi everyone. I am Keyur Punjani, part of Telangana AI mission, and very good evening to one and all who has joined us today. So we have here Dr. Masood Khan, Superintendent, who will be guiding us through the AMA, and you can ask questions regarding to the specific use case that we have floated on the AI-powered medical imaging diagnostics for lung conditions. So, Dr. Masood Khan, would you like to share a few words about the use case and the problem and the solution that we are expecting here, and then we'll put the floor open for questions from the attendees. Over to you, Dr.
Ma-
Mahbub. Sorry, Mahbub.
Mahbub Khan, not.
Sorry,
Okay,
sorry,
okay,
my mistake, sir. Yeah.
okay. No, no. What exactly you want? So, do you want me to use any inputs or anything else or
Yes,
anything?
sir. So the use case that we have floated was on is on AI-powered medical imaging diagnostics for lung
Yeah, yeah,
conditions.
yeah.
Right. So if you would like to share a few words, we have already floated this use case on the website, so the attendees would have gone through it, and after that they will be asking you questions. So, but
Yeah.
before they
That.
begin with questions, you can, if you would like to share a few words, Dr. Mahbub.
Yeah, yeah. Yesterday we had the meeting with the respected health secretary, madam, and DME and other dignitaries. So at last, what we came to know that the all the X-rays of chest X-rays will be submitted to the AI, and AI will detect the defects or suspect some, whether it is tuberculosis or malignancies, and it will give to the information to the concerned physician or doctor. So the concerned doctor, he will pick up the X-rays, and they will proceed further evaluation, whether it is tuberculosis or malignancies, so that we can screen the cases, and also we can have the early detection, early diagnosis of the malignancies, where we can have the good lifetime for the patients. That was the concept and conclusion yesterday what we had. But as per the scenario is concerned, particularly if the lung cancer is concerned, the best possible, and the even today is the best one is the utilization of the low dose CT scan to detect or to screen the lung cancers. So we prepared some protocols 1.5 years back in the chest hospital, taking all the studies throughout the world, and at last we prepared and each and everything. In that one, we will use the low dose CT scan just as a screening modality to screen the malignancies, and we will take the 65 years old persons, smokers with history of 25 pack years, and asymptomatic, and we'll submit them to the low dose CT. So if you find any lesions less than some measurements like 3 mm, 5 mm, 6 mm, so we will proceed, and we will continuously monitor those cases, having the this one doubling time and all those things. Then we will screen the patients for 1.5 months or 6 months according to the size of the lesion, so that we can detect the malignancy in the early stages. Because in most of the government owned hospitals, especially the chest hospital, we are getting 1 to 2 cases of malignancies daily, and out of them, the most of them, almost you can say 85 to 90%, are presenting with the third and fourth stage, where the lifespan is very short, maybe less than 6 months. So for that purpose, we designed it, and hope so it will be come into action. But meanwhile, the government came with the screening of the all the patients. For example, even the patient might be having some secondaries, and whenever the patient comes to the physician or any hospital, we'll take the chest X-ray basic investigation as a basic investigation. Those all the X-rays will be screened out by AI, and wherever we find the lesion, then we will proceed and we will investigate, and further investigation like chest, CT chest, bronchoscope, or PET, or this biopsies, whatever it may be. That was the conclusion and idea, and the concept what we are having at present.
Okay, thank you, Dr. Mehboob. So the floor is now open for questions pertinent to this specific use case. So please raise your hand virtually if you'd like to unmute yourself and speak. And you can also post your questions on chat box and Q&A, and we'll take up one by one. Attendees, feel free to ask your queries. Yeah. So I've got a question from one of the attendees, right now, Rishabh. So here we'll be doing bulk upload of medical imaging, or doctor's radiologist will upload the medical image separately in the UI and get results.
Yeah, all the X-rays will be sent to the AA center. There they will detect and they will send the information to the center from where they got the X-rays. That was the procedure.
Okay. Uh, so Vipul is asking, would there be any more data other than chest X-ray images?
No, at present, what happened, what the company or for this one, the agency is saying, they had the this one, what is the studies at Goa and Karnataka, in the states of Goa and Karnataka. In Goa, they did the nearly 26,000 X-rays. Out of the 26,000 X-rays, the X-rays means it's not the disease of lung disease. They have taken the X-rays for other purpose also, not only for the lung diseases. So they submitted it, and at last almost some people are not turned up. At last the 8 cases were detected and as the malignancies. That was the first data. And the second data regarding the tuberculosis, that is also from Goa. So in the tuberculosis also what they said, but they have not shown the data on screen, but they orally said that was the huge difference or a huge advantage in recognizing the early tuberculosis like that. So we had at present the data from Goa regarding the chest X-ray screening, that too particularly the malignancies.
Okay, thank you. I would like to also introduce M. Chokalingam, who is an expert, technical expert, who is joining from our team, and he will be also able to address any technical queries from the attendees. So, Choks,
Okay.
regarding the previous question, if you'd like to add or comment anything before we move on to the next questions.
So anyway, you are getting see the data comes with the labels, right? I mean, I've seen some of the sample data, right? So the X-ray and then the corresponding label with a bounding box, and then the label is in the JSON format. And then this is multi-classification use case. I mean, I've seen some of the samples. You can classify, I see 4, 5 kind of classification. So to look at the X-ray, I mean, you get the data plus labels. So with that, you have to build the model.
Yeah, so one thing I want to mention, that's why we asked this question, because in on the side, the documentation, it's mentioned like CT scan, for other things also it's mentioned there in the business problem. So that's why I think we're getting confused.
So one say X-ray again. Technically,
Hmm.
if you see, it's a 2D image, right? I mean,
Mhm.
so the segmentation is only going to be 2D. But if it is a CT scan, then it becomes 3D, and then the whole of use case labeling itself will be different.
That's why someone put that a question basically.
Yeah.
Like, do we have only X-ray for current scenario, or is there a different type of like CT scan or different type of data is there?
So
Uh, for the madam's question is the answer is at present planning is only to utilize the X-ray, chest X-ray only,
Okay, got it.
because the idea behind this one, this should be from the rural area to the urban area. So some areas where you can't have the CT facilities. So the X-rays are everywhere. Almost even the PHs, some PHs are also having X-rays. So at present, they are taking the X-rays as standard one, and with that only we can screen out. At present, there is no idea of using the CT as a screening method at present. So whenever you find some lesion or anything in the chest X-ray, the further evaluation by the CT, either to refer the case to higher center. If the patient is referred from the higher center, then they will proceed furtherly. But at present, the usage of chest X-ray in this project.
And TB is the main, the main area. Like you want to do the, what is the output that you are expecting? The prediction basically for the TB only.
No, not the TB. It is for tuberculosis and malignancies.
Okay.
It
So
is
if
for tuberculosis
yeah,
and malignancies, because the tuberculosis, the government is very pretty well committed to end the TB by 2025. And also there is alarming rising in the number of cases of malignancy throughout the India. So they have taken these two diseases particularly to screen out and to find out, because in malignancies, if you diagnose in the early stage, that is the first and second, you can go for the surgery and the results are very good, and the lifespan is more than the 5 years.
Second,
Okay.
please take a look at the data sets and the corresponding label. So you have, they have clearly mentioned 4, 5 kind of classification we have to identify from the X-ray. So look at the labels, please. What you need to predict.
Okay. So there are few questions in the comments which I would like to talk here before we go ahead with the people who have raised their hands. So is there any solution or platform developed for Telangana as of now, or would you be using the existing solutions like Cure AI, etc.? So this question is from Charan. Chalks and Dr. Mehboob, sir, would you like to address
See from my end, if you see platform, SaaS or a platform or service, clearly no, because this comes with the licensing and the stuff as a service. So somebody has to build a native solution, and then this is completely open source. And then for scaling, it has to be completely given to the government at no cost.
Yes,
this?
exactly.
Wonderful. Thank you. Moving on. What is the input like? Is it the digital version of X-rays? Will they upload into a platform that can be accessed by AI tool? Is that the expected data workflow? If yes, are the startups expected to build the platform or database for the X-ray digital version, or does government have any such platforms?
So typically you get the DICOM images as a sample data with the labels. That's all. We don't. It is not through any platform. I mean, as of now, government, I don't know any they have a channel to provide this X-ray. It's always you get as a dump in FTP and then with the labels, and you have to build a standalone application based on that.
Yeah, that was me who asked the question. Just to follow up on that, how do we get access to these dicol labels? So is it like, will every hospital send a physical copy to a common center, or how exactly do they collate it?
As per my knowledge, this is only the initial stage, and they will have some protocols and how to send these X-rays to the data center, and how many centers should be allotted. But tentatively, the government is planning 20 centers in the Telangana state, and how the labeling, what are the clinical history should be added, and the collecting data and how the data will reach to whom. These protocols, everything will be meticulously designed in due course only. But at present, they are not disclosed or anything else as on today.
Okay, sir.
As per my knowledge.
Thank you.
Thank you. So any more questions from the attendees? We have Vipul Sharma who have raised his hand. Vipul?
Yeah, hi. Thank you. Thank you so much. My name is Vipul. I'm from Cinema Machines. So I just wanted to ask you, like some of the panelists mentioned that they've seen the data. So is it possible we could get access to a very tiny amount of data so that we can see how it is structured right now?
Yeah, because we are collecting the X-rays throughout the centers, and definitely the data will be more. Only thing is the glaring feature here is after screening 26,000 X-rays, the result is only the 4 or 5 or the 8 cases only detected. But what about the tuberculosis? We don't know. So our aim is not only the malignancy but also the tuberculosis also. So we have to wait for the data from the agencies for whom we are looking, and the data from the Karnataka we are not we don't have at present. So the data what we received only from the one state, that is the Goa, that too particularly about the malignancies.
Sure. Dr. Mehboob, I think the question was pertinent to this challenge where the applicant would like to see the type of data structure that is available so that they can propose the solution accordingly. If there is a small or tiny sample that can be made available for that. So I would request Chalks if you would like to add anything to this.
Mr. Kayor, can I answer? Can I pitch in?
Yes, sir. Yes, sir.
Yeah, Mahbub sir, I'll just answer.
Pardon?
Yeah, Dr. Masood sir would like to answer this question.
I could not get it, the question.
The question was the applicant wanted to see sample data before they provide the before they approach the problem. That was the
Yeah,
question. Yeah.
yeah, definitely. Because once the government decide to go ahead with the project, the data will be revealed, and we will give the supporting data through what they did at Goa and Karnataka.
Sure. So I would also like to add it here that the data sets will be made available in the round two of the application if your application goes ahead. But we are also trying to make metadata available on the website so that you have a better understanding on what kind of data will be
Yeah,
shared at the round two. I hope, Vipul, that answers your question.
Absolutely, absolutely, Kevin. So
yeah,
that is what
yeah,
I was
absolutely.
looking for.
Yeah,
And if you could have that metadata before 30th, that would be of great help.
sure.
Yes.
Thank you.
Thanks, Vipul. Yeah, any more questions from the attendees?
I just got disconnected, please.
Yes, Dr. Masood. Yeah. We actually answered the question on behalf. So moving on to the next question. Once AI has generated the result, then where we are going to send this data, like back to data center with the result or to some other target system? Um, I would request Chalks to address if you would like to address this question.
So currently you have to send the prediction as a JSON file because I mean that's the input you are getting same thing because I don't think so you get an access to the DICOM system right now to send back the information. So inference to be done separately right now. I mean later part moment this want to scale then it goes to directly to the DICOM centers. Platform what DICOM platform what where the inference can happen.
Okay, thanks, Chalks. I hope this answers your question, Risha. Would be happy to take on more questions from the attendees. Please raise your hand or unmute yourself to ask the questions directly to the experts here.
Yeah, can I go ahead and ask a couple
Yes,
of
Jay.
questions? Yeah. So, are the participant expected to develop AI solutions for all imaging modalities like X-ray, CT, MRI, or can we focus on one of them?
Only at present, only chest X-ray.
Just X-ray. Okay.
Yeah.
Okay. And
Because other modalities like CT, MRI, and PET is not available in all the areas. So the
okay.
government's intention is to get the this chest X-rays from the rural areas also, PHCs and all those things. So first of all,
Okay.
the government will launch this one with the chest X-ray. In due course, they may extend they may add the CT and other MRIs also. But at present, what we came to know, it's X-ray chest.
Okay. And should it cover all the four diseases like TB, COPD, lung cancer, silicosis, or any one of the one or two conditions?
All the four because
Yet present, sir, continue, sir.
So yeah. So I mean, all the four because your labels are provided for silicosis. Or I mean, all the
Okay.
I mean, four lesions. Yes,
Okay.
four diseases.
And
Yes, sir. Over to you, sir.
any imaging data sets are being provided, sir, or is it how is that going to work? For these four diseases,
Imaging data sets will be provided. Yeah,
okay,
Yeah,
okay,
along with the labels. Yes.
okay. Imaging data sets will be provided.
All right. I hope that answers your question, Jai.
Yes,
Moving
yes, yes.
on.
I I have a few more if it is okay with you.
Please go ahead, but I would request you to be crisp in
Okay,
questions and put it one by one so that your
that's
question
fine.
gets answered in a row. Yeah.
Okay. Uh, will there be any patient metadata also available along with this to match the data sets on this one?
Yeah,
Okay.
yeah, sure, sure.
Okay. Okay.
So otherwise, how we can interpret? Because
True, true,
once
true.
the X-ray,
Understood.
yeah,
Because
Let me just step in on this. So the only data sets that you will be provided is with the chest X-rays and the classification of it, TB or not, COPD, whatever the condition is, along with the bounding boxes. This is the limit. This is the limited set of data that will be provided to you. Chest X-rays are simple digital images in
okay.
the form of DICOM or JPEG or PNG. Along with that, you get a JSON file with the annotations.
Understood. Understood. That will be more than sufficient. I just wanted to know if there's
No,
sometimes.
that is it.
Okay.
Yeah.
Yeah, those were the questions.
All
I'll
right.
ask if there is more.
Thanks.
Sure.
Chalks, if you would like to add anything to this point, if not, we'll move on to the next question.
No,
Yeah,
no, no, it is answered. Yes.
one more thing, sir. Like the data set that you were saying you have with the Goa, it has all the cases in the data. I mean, the data set, like for all the
Hi,
the
Rima.
output you're saying. Yes, yes, sir.
Sorry to cut you off. Currently, you'll not be getting access to those data sets. You're only getting access to some of the data, that is the Telangana data that we are providing. The data sets that we talked about, Karnataka, Goa, you'll not be getting access within this as a part of this challenge.
Okay, okay, fine. So I actually, but my concern is only like whatever data we will be get that has all the cases in the like X-ray. It should not be like only TB or like one or two. When
So
we
the
have to,
requirement, correct.
uh,
The use cases document says TB, COPD,
uh,
silicosis, lung cancer. So
so
these are the
yes,
4 conditions for which the predictions we are looking for. The
yes.
annotations that you have received are also across these 4 conditions. So we have coverage.
Okay, that's good. Okay, thank you.
Okay.
Yeah.
Okay,
From
so
the
before we go ahead with the next set of questions, I would I would like to address the attendees here. The questions related to the data sets and to the technicalities on the problem or the solution can be addressed to Chokalingam, and the questions related to the actual use case or from the government POV, on the identification of problem can be addressed to Dr. Mehboob, sir. So, with this understanding, we would proceed with the next set of questions. Yeah, please go ahead. I think Jai had more questions.
yeah, from a clinical metrics perspective, should we optimize? What should we optimize for? Like, for example, recall, precision, OCPRAC. Should we prioritize recall over precision for evaluation? Any thoughts on that?
So once it is diagnosed or suspected any information, then definitely you should take the information from the patient and you have to proceed further.
Okay. Is there any priority?
Yeah, since you have to
No, no, no,
mention,
no,
focus more on
priority is not there.
sensitivity.
So all the X-rays will be submitted,
Okay.
irrespective of the what we came to know yesterday the meeting. So irrespective of this one, some people in that one you may find some secondaries also, unfortunately. So
Okay.
for
Okay.
example, a patient was evaluated pre-operatively, they have taken the X-ray and suddenly they found something else. Yes, definitely the information will go to the physician. That what I said, the 4 diseases will be focused mainly.
Understood. Okay.
Docs, I
Hi.
think you
Okay.
wanted to add a point here.
Yes, yes. So you have to see when you are building your machine learning algorithm, you should look at sensitivity. Since you asked recall, we have to look at sensitivity, right? To positive and recall.
Yeah.
Oh,
Yeah. Hi, Kayur, and
Does
Dr. Mehboob.
that completely answer your question?
yeah. I
Yeah.
think yeah.
Yeah. You have to look at sensitivity. Yeah, true positive and recall.
Right. Moving on
Yeah.
to the next question, Mahesh.
So, hi, Kayur. This is Mahesh. So, I have a couple of questions. The question number
I
one
would
is like,
request to put your questions one by one so that it gets answered correctly.
yeah. So, I put already one question here in the chat. Will our solution to cover all proposed solutions which you mentioned in the use case, the five proposed solutions you mentioned, basically, or can we address partially with our solution, like AI-enabled imaging analysis, model integration, cloud-based edge computing options, security privacy mechanism, and workflow integration and usability? These are the five proposed technical solutions from use case. Do we need to address all of them?
Yes, yes, yes.
Okay. And the second question is, what is the selection criteria or like application site selection criteria?
As in selection criteria, as in?
In like once we submit our application, how would you evaluate? And basically, like I'm just curious
Sure.
to
Okay.
address all of your points
So,
while
Mahesh, I
submitting.
would request you to go through the evaluation criteria, which is there on the website. It will give
Okay.
you a brief overview about what are the parameters on which, the evaluators will be judging your application. There
Okay.
are evaluation criterias which are different for both the rounds. So, round one, we will be looking at your proposed solution,
Mm-hmm.
and the criteria are mentioned there. For if you proceed with round one, you will be made available with the data sets required to build the POC,
Mm-hmm.
and you can also use the other open data sets that you may have access to, and provide a POC solution to the round two for evaluations. And the criterias for round two are also mentioned there on the website. So
Okay.
if you would like to know more about that, we can take this later. But I would request you to first please have a look at the evaluation criterias on the web page.
Sure, sure. I'll go through it. Thank you.
Thank you, Mahesh. Yeah.
Yeah.
Any next questions?
Will we have access to some sort of a radiologist during the feedback, during the pilot phase, so that, if we can get some, refine the model in any which ways? Is it possible or?
So, Jai, we will consider this request, but we may not be able to commit to it. But we do have experts, from our partners who are working in this domain since long time,
Sure.
and we will be giving you access to them. And if you are going ahead with round two, we will also have similar kind of closed door interaction with experts to help you understand more and guide you through your journey for building the POC.
Got it.
And also, like, we are seeking the solutions from you because we also see that, as a startup, you may also have that expertise, and we expect that you should also have that expertise while
True,
you're
true,
proposing the solution.
true.
Yeah.
Because not being in the medical field, we have done good amount
Mhm.
of work in the healthcare space,
Okay.
but this is a little different. So yeah, fine. Um, Last but not the least, any expected, are we having, do we have any thoughts about the hardware environment in which this should be running, right? Or any for the pilot deployment or anything of that sort? Is it any thoughts around that also will help?
I would request Chalks to address this question since it
So,
is technical in nature.
see, while you build the model, yeah, you need a simple. I mean, since these are all X-rays, you need simple A100 servers are enough.
Mm.
But deployment is only on CPUs. I mean, the inference should be
Okay,
capable of running in the CPUs.
in CPS. Okay.
So optimize to that level so that the inference, at least the inference can run on the CPUs.
Okay. Are we expecting any integrations also to happen once the model is there, like, with,
Right now, no. I mean, you have to find out first the correct prediction. So once
okay,
the prediction is right, then the moment it goes for scaling, yes, integrations you have to think on where to integrate with the current system.
understood.
So for this current like challenge, you just want everything should be run on the CPU only. No
Right. Yes,
GPU,
yes, yes,
no
yes.
cloud,
Inference,
no cloud integration.
no, no. So it is on. I mean, most of the solutions are on-prem, so it should be capable of providing the solution in any of the on-prem solution given by the government.
Okay.
So as you can see, there are, in the limitations mentioned in the use case, there might be limited internet connectivity in the remote areas of Telangana, and hence on-prem solution is suggested here. Yeah. So I have one more question from Rishabh. We are a subsidiary of US headquartered company registered in India. got invitation from this our partner, and can we participate or not? As it is mentioned that company should be headquartered in India. So Rishabh, the company should be based in India, and if it's a subsidiary, then it may not be eligible for this specific challenges. Okay. Any more questions from the attendees?
Yeah, I actually I got confused with this CPU and GPU thing. Can you give more clarity, sir? Like, because this image processing, as you know, this require like GPU to run these models. So can
So that's
you
what I
just
said. Yes. So that's what I said.
uh,
When you are building the model and image processing, yes, you need a GPU, at least to the A100s or even A10s. But moment you build your model, the inference part should be on a CPU.
okay, fine. I mean, okay. For the deployment or something that with
Yes, you
the
are
later.
deploying the inference, right? I mean, that should be a
Uh-huh.
CPU deployment.
Okay. Any further questions? All right. So if this AMA in next 20 seconds. Yes, Dr. Mehboob, you would like to.
Last but not least, what happens? There are some defects in the mainly to rule out or screen out the tuberculosis and malignancies. See, the some patients, the tuberculosis, most of the tuberculosis lesions yield by calcified lesions, where the chest X-ray, if you put the chest X-ray in the AI, it will suspect the malignancy. See, in that is the gray area where the clinician should be very careful. So even the patient is having the old healed calcified lesion in chest lung, and the AI may give as the malignancy, because that was the area where we are more concerned. In India, particularly because of the tuberculosis incidence is more, and we should be very careful, particularly the physicians who are looking after this patient. So do not depend wholly on the AI, and we should, as someone said, there should be some clinical correlation and physician's capability and the patient's symptomatology. Everything should be taken once we are labeling to the patient as a malignancy. That is the one concern. I think in due course it can be overcome by having some other further investigations.
Sure. Thank you, Dr. Mehboob, for the insights from the practical aspects. I
Yeah.
hope information helps the applicants on on how they're submitting the approach notes to us.
Yes. Thank you.
So I'll still wait for 10 more seconds if there are any questions from the attendees.
So it's going to be a very new one, but I think it's useful, as the rural areas will get the X-rays and screening out, and we should see how best we can give the services and how it is going to be successful. Once we launch, then only we'll come to know, because there are some studies showing that it's giving the good results. So hope so it will be a successful one and a useful one.
Sure, sir. Yeah.
Thank you.
All right. So I think there are no further questions from the attendees who have joined us for this AMA. So thank you, Dr. Mehboob Khan, for answering and addressing the questions from the attendees. And I would also like to thank Chokalingam, who is our technical expert under our team. And with this, we will wrap this.
And Keyur, just a second. This is Mahesh.
Yes, Mahesh.
If we have any more questions, can we contact through email?
Yes, the email ID is ai4tg@nascom.in.
All
Okay,
right. Okay.
so
Yeah.
it will, you can raise your queries and we'll be happy to answer them, technical
Sure.
or non-technical in nature, both.
Yeah. Thanks, Keyur. Thanks, Dr.
Right.
Mehboob. Yeah.
Yeah. Thank you so much, attendees, for joining. And we'll have the last AMA also on the healthcare use case, which is for high-risk pregnancies, which is planned at 5 o'clock. So we will have another expert from the government department joining to address your queries for that. So if you're planning to apply for another use case, please join us using the same link at 5 o'clock. Thank you so much. With this, we will
Thank you.
end this AMA. Thank you, Dr. Mehboob.
Thank you. Thank you.
Yeah.
Thank you.